Welcome to the Dr. Joe Show, where we talk about women's sexual health and wellness. And we have the privilege today of having Dr. Martha Boone on to educate us further. She is the author of 2 books and has a great background in urology. And Dr. Boone, would you please introduce yourself? And thanks again for coming on.
Yeah, thank you for having me. I was one of the first 100 women board certified in urology. So when I started as a urologist, it was 98% male. And over 35 years, we've made some progress. Now it's, I think, 93% male. So things have moved up a little bit. And even though the field of urology, we treat a lot of male patients, because I was a woman, I saw far more females than the average urologist saw. So I have had a lot of background in taking care of female urology problems.
Gotcha.
I retired about 3 years ago to write. And my first book was a novel, loosely based on my time at Charity Hospital in New Orleans when I was doing trauma surgery there. And then my second book is the one we'll mostly talk about today. It's The Unfettered Urologist. And if you've ever been to the doctor and felt like you just didn't have enough time, you just wanted 15 minutes more, then what I do in the book is I kind of go through the things that we didn't have time to do in detail for an office visit and basically answer the questions. And it is a bit of a memoir, so there's some funny stories, and medicine's full of tragedy and humor, so there's a lot of that in there. If you enjoy things like MASH, then you'll probably like the book. But as far as women's health goes, the first thing I'd like to mention is the disease interstitial cystitis. We don't exactly know what it is, but patients will have frequency and urgency, and they will have pelvic pain. And it's not anything to ignore. Most patients would start with their gynecologist because we want to make sure that there's not something going on there. Most of the time it's treatable. If the gynecologist doesn't find one of the common problems that can cause pelvic pain, like endometriosis, then they would end up sending you to urology. And both gynecology and urology would want to make sure that there wasn't a bladder infection. So anytime that the woman has frequency and urgency, it could be something as simple as something she's had to eat. There could be an irritant. Some people are sensitive to citrus. So the first thing to do is just to drink a big glass of water to see if you can kind of flush whatever it is out, that could be irritating you.
Right.
But if it persists, then you definitely want to see gynecology or urology for evaluation. Do you want to ask me questions as we go
Yeah.
along, or you just want me to keep
Yeah,
talking?
I've already got a couple questions.
Okay.
Don't mind, I'll jump in here and there. When you talk about that particular issue, that challenge, would this mostly affect younger women, older women, or just kind of any age as far as the interstitial?
It can affect women at any age. Most of the time, if it really is interstitial cystitis, it'll show up in the 20s or the 30s. But there is the occasional patient will be 40 or 50 before it will show up. But it usually does show up in the younger women.
And does it won't resolve itself at all? Needs to be dealt with as far as the intervention that you're talking about. Is that correct?
That's the fascinating thing. It does resolve itself in a large percentage of patients. And so frequently just taking an over-the-counter agent, something like azo, that could decrease the pain, will get rid of it. But if the patient is getting progressively worse, that could be an indication of a bladder infection or something more serious. And so they definitely want to see their doctor. But occasionally it does go away on its own.
Okay, so but it's probably the best case scenario would be to be able to be seen about it and maybe nip it in the bud as far as getting some help as far as early on with the situation. Am I
Yes.
correct? Okay.
Yes.
And one other thing I want to make sure we do both now, kind of toward the beginning of our time together, and then toward the end, is make sure that our listeners have your website, because as I understand, a lot of information is on your website that where people can educate themselves and maybe cut off some problems, from actually ever getting worse. So what is your website, if you don't mind, Dr. Boone?
It's pretty simple. It's just www.marthaboone.com. And there's information on there about 2 of my novels, one which came out in 2018 and one which is coming out in early 2024. And then all of the references for my book, The Unfettered Urologist, which is nonfiction, are also on the website. So anything that we talk about that the viewers, I mean, the patients have further interest in, they can definitely look on my website and get the more detailed information about, where did that idea come from.
So that's wonderful that you make that resource available. Did I get it right? drmarthaboone.com?
It's just marthaboone.com.
Okay, just marthaboone.com. Okay, just marthaboone.com. So I will remind everybody at the end of that as well. So, but go on. What other issues, unless we're not done on that one, what other issues would you say well, again, you might want to start with if there's issues for young women, and then we can work through those. And then if there's issues for older women, maybe even premenopausal, postmenopausal, if that applies. So you're the expert in this. So how would you like to proceed?
So I think I'd like to talk in detail about urinary tract infections in younger women, because I think that is a real point of power.
Mm-hmm.
And we'll start out by talking about the anatomy. And if it's okay, I'll be fairly blunt in describing it.
Yeah.
So
Yeah, we do that here. Don't worry about that.
Okay, great. Great. So the largest collection of bacteria in the body is in the rectum. And the rectum is right next to the vagina, which is a warm, moist culture medium, which is right next to the bladder, which in most people is supposed to be a sterile organ. So it's kind of a bit of a mystery as to why all women don't have bladder infections. We think some of it has to do with good hygiene. We think some of it has to do with drinking plenty of water to flush everything through. We think a lot of it is the local immune system, but we're not quite sure. But some ladies are plagued with these bladder infections, and it can be life-altering. I mean, can you imagine being a professional woman and you're on an international flight going to China to give a presentation, and next thing you know, you're urinating blood?
Ew.
So it's not something that's likely to kill you when you're young,
Mm-hmm.
but it can most definitely affect your life.
Mm-hmm.
So, what can the woman do to help decrease her chances of getting this? Right now in our culture, we have people just drinking tons of water, and that's actually a little bit crazy.
Mm-hmm.
So, I'd like to just take a second to talk about how much water we should be drinking.
Please do.
Unless you have a medical condition where your doctor has told you something specific to do, then it's your body weight in pounds divided by 2 in ounces. So let's say you weighed 140 pounds. You
Mm-hmm.
would divide that by 2, that's 70. And that number in ounces would be about what you would have on a regular day. Now, obviously, if you're a marathon runner or if you're completely sedentary, you might need less or more. But when the patient looks into the toilet, the urine should look like pale lemonade if they're hydrated enough.
Mm-hmm.
So that's the easiest thing to do, is just to keep yourself hydrated. And it's just simply a mechanical thing. It pushes the bacteria out of your bladder base.
Mm-hmm.
If you're one of the people who gets recurrent bladder infections, then you really want to be sure that you don't take too many antibiotics, and that you don't take too strong of an antibiotic, and that you don't take too long of a course of antibiotics.
Mm-hmm.
In America, physicians have really overused antibiotics. And so what we have done is we have caused superbugs.
Mm-hmm.
The bacteria are brilliant. When we introduce an antibiotic into our body, the bacteria is able to mutate and change. And
Mm-hmm.
so the more antibiotics we give them, the stronger are the bacteria that live in our gut,
Mm-hmm.
which is called our microbiome. And so if we have to take an antibiotic, we want to be sure that it's the weakest one that would work for what we have. Now, if you go to an urgent care, you go to your primary care doctor, the doctor wants to make you feel better. And so they'll take a urine specimen, they'll see signs chemically that there could be a bladder infection, but they have no way of knowing what it is until it goes off for a culture. And that usually takes about 3 days to grow. So during that time, the woman is miserable.
Mm-hmm.
So the doctor will prescribe an antibiotic. Sometimes they'll give a strong one. And if you repeat this process over and over and over again throughout the course of a year, then you can end up in the hospital with intravenous antibiotics. So we want the patients to be aware that the fewer antibiotics, the better. Mm-hmm. The least strong antibiotic, the better. And the shorter course, the better. Mm-hmm. And you want to partner with your doctor to understand that we need to all be good stewards of antibiotic use, because the scenario can end in the person having a bacteria that we can't treat. Right. That the bacteria have mutated so much that we have one of those superbugs, and then we have run out of opportunities. So the first thing I'd really like to make sure is that everyone realizes that there's no free lunch with taking antibiotics. Now, let's say you're at home, it's on a Sunday afternoon, and you're thinking, oh gosh, here we go. Is this happening to me again? So what would you do? If you have no medical contraindication, if there's no reason that you shouldn't do it, then you could either take an ibuprofen or a Tylenol or an aspirin, and then you could take one of the bladder numbing agents. And one of the more common ones is Pyridium. You can either get it over the counter or you can get it as a prescription. And the combination of those two things would decrease inflammation and kind of numb your bladder a bit. And then you would drink, a big glass of water. If that didn't help things, then you would know that you would need to call your doctor. If you kept getting worse and worse and worse, then you would need to contact your physician. One of the things that I write about in the book is that if you have a good relationship with your doctor, sometimes you can get them to give you antibiotics to keep on hold at home so that you could do single dose or 3-day therapy that you would start yourself. The advantage
When
of
you feel
that is,
it coming on, is that the way it would be? I mean, early
yeah,
on, that would be the
yeah, when you
idea.
feel it coming on, you would try taking the things that I mentioned a moment ago. If that didn't
Right.
settle it down and you had, a contract with your doctor about being able to start the antibiotic on your own, then a lot of times that would knock it out before the bacteria got in there and really took hold, because they're in there growing and they have something called a doubling time. So for each hour that you're waiting to start the antibiotic, the number of bacteria growing, the toxins they're releasing are becoming, exponential basically. And so
Right.
the quicker you can get the antibiotic, the better. The negative of that is that the doctor doesn't have a culture, so that if you are growing an unusual organism, it won't grow if you've taken an antibiotic. So there's positives and negatives to both sides, but you definitely want to be under a doctor's care before you make a decision to treat antibiotics, unless you have some kind of agreement with them about what to do.
Right. Well, that makes a whole lot of sense. Just a couple of things I want to try to review for our listeners and watchers. And tell me if I didn't get this right, but I think it's wonderful advice on the water drinking. And you said that you should take your body weight and divide it in half and drink that much water in ounces per day. Am I correct on that?
Yes, unless you have some medical reason not to.
Okay. And then the gist of what you've been saying about the antibiotic use, there's definitely some nuance there that you're talking about, and you're definitely advising a doctor's care in it. But you're also making the point that I think a lot of us end up being prescribed antibiotics very, very quickly, and kind of in a maybe over prescribed as far as antibiotics go. And when they are over prescribed, or they basically make the bugs, the ones that survive, more to the superbug type situation, like you're describing, where they're harder to treat. So I think the essence of what you're saying is, again, this is you and your doctor, but try to get the lightest, the lightest, I guess, antibiotic that would cure what you got, rather than going right to the really heavy duty ones if you don't have to have them. Am I correct on that?
Yes, that's correct.
Okay.
Yeah.
Yeah, I just want to reiterate. I mean, I want to review that because I think this is wonderful information. I think the people that are listening can gather up the big take home points, and I think those are a couple of them right there.
Yeah.
So,
So the other thing I'd like is for people who are having more than 3 bladder infections per year, it's very important to work on prevention. And one of the biggest arms of the prevention armamentarium is cranberry supplements. Now, I knew for about 20 years that patients would come in and tell me, oh, I'm drinking cranberry and it helped me. And then others would come in and say, I'm drinking cranberry and it's not doing anything.
mhm,
So, what I learned over the years is that the cranberry juice, if you drink enough of the pure cranberry product, it will decrease bladder infections. But the volume you need to drink to get that effect will cause you to gain about 10 or 12 pounds per year unless you decrease other calories that you're taking in. It's also a heavy sugar load,
mhm,
and your bladder loves sugar. The bacteria will really grow in a sugary environment.
mhm,
So what you want to consider is to purchase a good quality cranberry supplement. Now, unfortunately, some of the supplements that have the best advertising budget don't have the best product.
mhm,
So I wanted to just tell patients what comprises the best product. So number one, why would cranberry work? cranberry juice and cranberry supplements have something in there called proanthocyanidin.
Mhm.
And what it is a big medical word for a product that will be in the bladder that causes the legs of a P. fimbriated E. coli, which is a little bacteria that's very common in the bladder, to
Mhm.
stick together so that when you drink that water, they'll be washed out more easily. So it's actually kind of toxic to the bacteria in the best situation. Now, three of the products that I have no financial relationship with that I have seen work very well are called Theracran, Urel, and Utiva. And I get nothing from any of these companies, but the information about them are on my website. And what you need to have the cranberry supplement work is you have to have at least 36 of those proanthocyanidins per pill for
Mm.
them to work.
Yeah.
And you can see the detailed research about cranberry on my website if they're interested in that. But it is the volume of the PACs in the pill and the quality control of the pill that makes it actually work. So if you're taking a cranberry supplement and you're going, it's not working, you want to make sure that you do have one of the quality products that has worked. I would say it's caused a 50% decrease in UTIs in my patients over the years.
Wow, that's a great record. And as
Yeah.
a matter of fact, when I was younger, I've had some issues with those kinds of bladder infections, that type of thing. And cranberry juice or cranberries themselves again, this is like 30, 40 years ago, but the same thing was being was realized that cranberries do have an effect. The essence of cranberry, I guess you'd say, what the derivations from cranberry have a pretty good effect on it.
Yeah. And then another common question I get is, what does sexual intercourse have to do with a bladder infection? So we don't exactly know, but we think it's some trauma to the urethra. And we also think that it makes it easier for the woman's bacterial load to get to the urethra. So these bacteria that live in the rectum, they have to track across the perineum, which is that piece of skin between the rectum and the vagina. And then
Right.
they have to get from the vagina to the urethra. And we think that active sexual intercourse helps them get there quicker. So that's why people may notice that that is a problem. And if a person has that as a repetitive pattern, we would ask them to always get up and drink a large glass of water and have a good void, urinate before they go to bed.
Mhm.
And also to consider taking their cranberry supplement at night or after the sexual activity.
Okay. So yeah, so that's actually I've heard of that before, that kind of that regimen, so to speak, and that would be important to do. Yes, all of this is wonderful information, especially for people that have been dealing with these types of things and think there's really no recourse, for them. They're just going to have to suffer for them. So go on. What else? What other great insights have you got?
So a lot of patients come in having taken all kinds of herbal supplements, and I mean, I just can't even tell you the number of things that people have shown up taken. There's on the internet some information that vitamin C helps. I haven't seen that really help bladder infections. In fact, vitamin C can be a bladder irritant. So
Hmm.
if you're one of those people who's having frequency and urgency, you want to stop your vitamin C for a week or so and see if those symptoms go away. But we haven't found that to be nearly as effective as the cranberry. A lot of patients will also use something called D-mannose.
Hmm.
I haven't seen any side effects from that, so I've seen no negative aspects to using it.
Hmm.
But I would say it probably works about half as well as the cranberry. So if you were going to try something, I'd probably try the cranberry first.
Hmm.
Um, in older women, part of the problem is lack of estrogen in the vagina. When a woman is young, the vagina is very acidic, which
Hmm.
tends to kill the bacteria, and it tends to produce lactobacillus, which is a very healthy type of bacteria to have in the vagina.
Hmm.
As we age and our estrogen goes down, our vagina becomes more alkalotic so that the bacteria can just really have a big party in there. So for older women, sometimes just putting a tiny amount of vaginal estrogen down there can change the pH.
Hmm.
It can help decrease the number of antibiotics that would be necessary in the course of a year. And so
Okay.
that would definitely be something to discuss with both the urologist and the gynecologist.
Okay, so if I'm hearing you right, younger women have a vaginal environment that is tougher for bacteria to invade and that type of thing. But as women age, the you said the pH versus the acidic element, as they age, it becomes less acidic. Is that correct? And more
Yes.
pH. Okay.
Yes.
Um, yeah. So was going to ask you a question about that. Sex as women advance in age seems to be somewhat problematic for a lot of them. Are you, where are you, Dr. Boone, on those types of things as far as like supplemental estrogen on the vagina, the vulva area and that type of thing? And just in general, those kind of hormone replacement, you know, uh, types of moves that women can make to.
Yeah. So, urologists, we are experts in male hormone replacement, along with our endocrinology
Mhm,
colleagues. We work with them on that.
mhm,
But I have more experience than the average urologist in females because
mhm,
I had so many female patients and I interacted so much with gynecology. But for female hormone replacement, the kind of doctor that usually does that is the gynecologist or an endocrinologist.
mhm,
I feel like the dangers of estrogen have been grossly overspoken.
mhm,
There are some women who have genetic forms of breast cancer that are estrogen sensitive, and by all means, their oncologist should be the one who makes the decision about that.
mhm,
For the average woman, a small amount of topical vaginal estrogen can really improve their quality of life and doesn't carry much of anything in the way of risk at all.
mhm,
So, if women are having these problems, I would definitely have this discussion with your gynecologist because many women can use these things safely. And the studies that came out that were so against estrogen use, they have for the most part been debunked in most categories. So I would not just, remember that that was a negative thing from the past and not seek treatment. I would definitely have a discussion with your individual doctor about what your risk and benefits might be. But if the woman does absolutely no hormone replacement, the vaginal tissues become thinner and thinner. Vagina kind of shrinks down. And for anyone who desires to have sexual activity long term, um, something has to be done. Now, some of the gynecologists in our area are using laser treatments to help rejuvenate the vagina. I have no personal experience with that, but I saw a number of patients who received benefit. So there are new techniques that don't involve hormones. So even the ladies who, for whatever reason, could not use any hormones, there is hope for them also.
mhm. Well, great. Thank you for that excellent answer. And it brings to mind another question I have, and what I deal with, Dr. Boone. A lot of it has to do with, casual sex versus marriage, monogamy versus polygamy, or I guess you'd say promiscuity in your practice. And again, and I know it's, mostly been male oriented, but do you have any thoughts on how much problems that people give themselves, and particularly women, by engaging in promiscuity, or do you see that as really not a problem, not problematic? Having lots of casual sex versus a monogamous relationship. What would your thoughts be on that?
So there aren't any real medical studies that I've come across that show, one thing versus the other.
Mhm.
Um, I don't honestly have a strong opinion about that. I mean, I have feelings as a social
Yeah,
person,
yeah.
and philosophical beliefs. But as far as like a medical opinion, I don't really have a
Okay,
strong medical opinion.
okay, and that's okay. What other issues would you say? Well, let me give you a situation and maybe get your thoughts on it. One of my friends is a researcher at Vanderbilt, of course, is here in Nashville, and she researches the different strains, particularly of STIs, STDs, however you want to refer to them. One of them being gonorrhea, and she has mentioned to me, actually more than once, that gonorrhea is being treated so much these days that that phenomenon that you're talking about, and has been for a long time, of producing a superbug, she sees that happening and coming. And her opinion is that it's not going to be too long if things continue on the way that they are, where gonorrhea is going to be untreatable with antibiotics. So, do you have any thoughts on that, as far as, again, your experience and just kind of your background and that type of thing?
Well, I haven't followed the literature on that because I'm not an infectious disease doctor. And where I practiced, I saw very little venereal disease
Mm-hmm,
in the area that I practiced in the last, several decades.
mm-hmm,
But I mean, the logic of it is the more bacteria that you get inside of you that are not your native bacteria. And the more strong antibiotics you have to take, those things are going to mutate.
Right.
And you're going to get to the end of the road where it can't be treated.
Right.
And, your friend would know more where we are on that timeline with gonorrhea, but I know for at least 5 years we have been concerned about it,
Mm-hmm.
because strains have shown up that they've had a hard time treating. So,
Mm-hmm.
I mean, I think things like that speak to the point of the promiscuity that you were talking about. I mean, it's just the more people you're involved with, the more likely you are to run into different bacteria. I mean, that's assuming that you and your partner are monogamous and faithful to one another. Statistically, you would have a lower chance of catching anything like that. So,
Right. So preventive, kind of a preventive approach there, obviously. And in what you've shared so far, I really see a lot of wise prevention that you're talking about, as far as the amount of water to drink without overdoing it, and, you know, um, keeping your antibiotic load low as you need, and needs to be, in that type of thing. So yeah, I see a lot of wisdom in what you're sharing here. What else? We just got a few minutes left. What other kind of things would come to mind? And it could even be, maybe the major things for men, because most of the people that are listening probably have a loved one that's a man, in their life, at least one,
yeah.
husband, brother, dad, uh, whatever. In the last maybe 5 or 6 minutes here we have, what would you say are some of the more important things you'd like to throw in?
So I'd like to just say one thing, continued with the women.
Hmm.
Um, in America, doctors are quick to go for the big fix. And so a lot of times we overlook minor things that could take care of the problem. So if you're a woman who has incontinence, let's say you just had a baby and you're leaking urine and you're all upset about that, you may go to your doctor and they may say, let's do a surgery on you. We can fix that. I would like for all women to realize that the field of pelvic floor physical therapy can do amazing things.
Hmm.
It can help with fecal incontinence. It can help with urinary incontinence. It can help with pain during intercourse. It
Hmm.
can help with all types of pelvic pain. So keep in the back of your mind that your gynecologist or your urologist may not think to send you to pelvic floor physical therapy, but in every major city, there are people who are trained in this field, and everywhere else in the world, they get great results because they're the first line of treatment. Doctors will send them to them first. So I just want to make a little pitch for pelvic floor physical therapy as a treatment for pelvic pain, pain with intercourse, fecal incontinence, and urinary incontinence. And I think it should be the first line of treatment. If you go to a doctor and they recommend for you to have a surgery right away, you want to step back, take a deep breath, and think about it for a moment, because every surgery has the potential to fail. Incontinence surgeries, they work somewhere between 70 and 90% of the time, but still, if you could do something like physical therapy, that would be better. So as far as the men go, um, men hate getting prostate exams, but
Right.
it's so necessary. And prostate cancer is a much worse disease in the African American community. So I definitely would like to get the word out there that if you are an African American man and you have had any blood relatives that have had prostate cancer, brother, father, grandfather, uncle, anybody, you need to start going to urology when you're about 45 years of age,
Hmm.
so that you can get a baseline blood test and you can begin to have examinations. And then all men who have any prostate cancer in their family definitely need to be seeing urology by the time they're 50.
Hmm.
There was some work that came out through the government a couple of years ago that said we don't need to screen for prostate cancer anymore. And, quite frankly, that was ridiculous.
Hmm.
We have a disease process and we're going to stick our head in the sand and pretend like it's not going on. What you want to make sure is that you don't rush to some drastic treatment until you're certain that it's the right thing for you. But,
Hmm.
not getting evaluated for something just doesn't make any sense. That would be like not having your mammogram or not getting your colonoscopy. So men do need to have this on their radar and they do need to be evaluated. When
Hmm.
you're under 45 years of age, it would be very rare to need any type of evaluation unless you had a really strong family history. If 2 or 3 men in the family had prostate cancer. Then the other little tip for men, and this goes for women too, is about kidney stones.
Hmm.
There are 3 different types of kidney stones. 2 of them are inherited. But the main cause of kidney stones is number one, not drinking enough fluid.
Mhm.
Number two, having too much salt in your diet.
Mhm.
An old wives' tale is that it was caused by calcium consumption. Well, it turns out that if you cut calcium out of your diet, you're more likely to make kidney stones. So you want to be sure that if you ever make a kidney stone, that you
Yeah.
fish it out of the toilet, dry it off, and take it to your doctor so they can figure out what caused it. But if you want to do anything to prevent it, just drink plenty of water and avoid too much sodium in your diet, because that can be the main causes of kidney stones. And then the third little tip for men is just like women go through menopause, men go through andropause.
Mhm.
And just like some women go through menopause and never need any hormones, they do perfectly fine, they go through it naturally. Many men will go through andropause and not have any problems. But there are those men who will have poor sleep, fuzzy thinking. They're just not themselves. Their
Mhm.
function at work goes down, and those guys actually need hormone replacement therapy for a period of time.
Mhm.
And the urologist and the endocrinologist are the two kind of doctors that do that.
Mhm.
We've unfortunately seen these hormone clinics pop up, and they're giving men doses of testosterone that's much higher than they should be taking. And of
Mhm.
course, the men feel great; they feel, all muscular and healthy and everything, but it's causing their prostate to grow and can be causing them a lot of problems further down the road. So if you
Mhm.
decide you want to do hormone replacement, you want to be sure you're going to someone that doesn't necessarily have the best advertising budget, but is actually trained to take care of this problem, which is urology and endocrinology.
Well, that makes a world of sense too. And yeah, I can relate to a little bit of what you're saying about the prostate growing and prostate, I should say, growing and the need for exams. Although I wish that we could figure out a better, a less uncomfortable way to have a prostate exam. But
See, that's the reason to go to a girl, because we got little skinny fingers.
yeah, I think you're right. I think having a female urologist is a huge advantage. But
Do
this
we
has
have
been,
time for a funny story?
yeah, please. I was going to ask you that.
So when I first started practicing in Atlanta, we would have these free prostate screening sessions, and every time I would go, and no one would want to come in the room with a girl. All the men were embarrassed, so they would go in the room with the men. So one fateful night, this Delta pilot became impatient, and he's like, "I'm going in there with a girl." So I had to put down my coffee cup and give him an exam and everything. So he ran out to the waiting room, told everybody out there, "She has a skinny finger," and the whole line shifted. And I went home with the ice pack on my finger. And for the next 20 years, I had a plethora of Delta pilots as patients, because they would all tell each other, "You got to go over there. She's got a little bitty finger." So
That that's amazing. That's a great story, and I can relate to that because boy, that's something you just you don't experience. At least most of us don't experience, and it's very can be kind of painful. So having a woman, and as a matter of fact, the last doctor that gave me the examination for that was a woman. So, and I didn't take note of it at the time, but now it makes a lot of sense why it went better with her than the guy that that was before her. I think maybe that's true with some of the surgeries I've had. Although I had a really good like hernia surgery not long ago with a man, but I had a bad experience with the male surgeon before that. So I think there are some real advantages to having female medical personnel, doctors, and that type of thing. So
I
um,
wouldn't make that strong of a statement, because just about all of my doctors are male.
mhm.
But I would have an open mind about it. You want to go to the best person.
Right,
Yeah,
the
doesn't
best
really matter.
person.
Yeah, the
Yeah,
best person.
the bedside manner though I think I've thought this just naturally in most cases better with the women. That's just maybe just me, but hey, I want to say once again and make clear, your books, the name of your books and your website, because this has been an awesome interview. I just so appreciate it so much. You have so much important information, more than important, kind of like life-changing information to share. So I want people to be able to get to your website. So and to get the book. So the books are the nonfiction book would be The Unfettered Urologist, and I think we've got them. Yeah, we've got them right. Got it right there. Looks like a
Yeah.
wonderful read. And then the novel, which sounds fascinating to me, is it The Big Free?
Yeah, it's called The Big Free, and it's a coming of age story from my first 6 months doing trauma surgery at Charity Hospital, New Orleans. And the sequel to it is coming out in March, and it's called Mother Charity. And it's available at booksellers for pre-order if people are interested.
MarthaBoone.com is your website, marthaboone.com. So everybody just please go there. This woman has a wonderful set of knowledge, and let's just all benefit from it. So thank you again for being on, Dr. Martha.
Thank you for having me. I appreciate it. We had a good time.
Yeah, we'll do it again. Okay.
Okay, sounds good.
All right. Take care.
Okay, bye bye.
Bye bye.